Assalamu alaikum. Auzubillahi minash-shaytanir-rajim. Bismillahir-rahmanir-rahim. It's a series of lecture about gynecology. It's a 10 page at a row. Start with this breast mass. Okay, if there is palpable breast mass, if it is age less than 30, if it is age more than 30, if it is age less than 30, ultrasonogram with or without mammogram. If age is more than 30, ultrasound mammogram with or without ultrasound. So mammogram first if it is age more than 30. Okay, if age less than 30, if it is simple cyst, just needle aspiration. If patient wants, if patient doesn't want, then just observe. If it is complex mass or cyst, image guided biopsy. If age more than 30, the suspicious for malignancy, do core cut biopsy. The workup of suspicious breast mass is unilateral, firm, fixed, causing nipple retraction is the same in men as in women. So suspicious, the word suspicious in here you have to think if it is unilateral, fixed and causing nipple retraction or not. Breast ultrasound may be helpful to further categorize the mammographic abnormality and aid biopsy. If suspicious feature like microcalcification, speculated margin are seen on imaging, a core biopsy is performed. So suspicious for malignancy, microcalcification or speculated margin, core biopsy is performed. Direct excision without preceding imaging or biopsy may be considered for a mass that is clearly benign on physical examination, or that is well circumscribed, non-fixed and soft lipoma. PRCA mutation is indicated in patient with a family history of ovarian cancer. BRCA is done with a family history of ovarian cancer at any age or a personal family history of breast cancer at age less than 15, first degree relative. It is not indicated for a family history of endometrial cancer or breast cancer at advanced stage. BRCA is indicated for family history. BRCA is indicated in family history of breast cancer in two or more than two relative, one whom is diagnosed at age less than 50. So this is IL. When we will do BRCA testing, if one of the relative died of, or if one of the relative has breast cancer diagnosed age less than 50 and another one is more than 50, so two or more than first degree relative with a family history of breast cancer, BRCA testing should be done. Simple breast cyst. Simple breast cyst management. If it is simple, if it is complex, if it is complex, do biopsy. If it is simple, then asymptomatic, then just observe. If it is simple, if it is tender, then FNA. If it is bloody aspirate, then biopsy. If it is non-bloody aspirate but persistent and recurrent, biopsy and additional imaging. If non-bloody aspirate, cyst resolve, repeat, ultrasound 4 to 6 weeks later. So in a breast mass, if it is simple or complex, you have to rule out this. In simple cyst, the criteria should be it is thin wall, fluid filled. A complex cyst should be fixed wall, thick walled and a solid component Thick wall solid component is called complex cyst. This thick wall solid component. Okay, on ultrasound, if simple cyst shows thin walled fluid filled and a complex cyst, thick walled and a solid component, that would automatically require a core needle biopsy. Although simple cysts may be observed if they are asymptomatic, symptomatic cysts can undergo fine needle aspiration for pain relief. Further management then depends on the results of the aspiration. If the fluid is bloody or the mass persists, that is remains visible on ultrasound and or palpable despite aspiration, patients may be at increased risk for breast cancer and should undergo cone-needle biopsy, which can provide a definitive histologic diagnosis. In contrast, if the aspirated fluid is not bloody, the breast mass resolves completely. Low risk. Patients are at low risk for cancer and may undergo observation with the repeat breast examination in 4 to 6 weeks. As the cystic fluid can reaccumulate, if the patient has no further symptoms or sign of recurrence, annual screening is resumed. Male breast cancer. Male breast cancer family history of BRCA1 and 2. Abnormal estrogen or androgen ratio, Klinefelter syndrome, obesity, cirrhosis, marijuana use, and presentation is subareolar mass, skin and nipple dimpling, induration, ulceration, often detected at advanced stage. Um, Male breast cancer diagnosis, mammography, biopsy, invasive ductal carcinoma, hormone receptor positive, more most common characteristics feature that can distinguish benign gynecomastia from malignancy include gynecomastia can have variable density but is typically symmetric and is centrally located with respect to the nipple, may have indistinct margin with surrounding band. Breast cancer is more likely eccentric to the nipple and has well-defined spiculated margin and may contain calcification. The diagnosis can be confirmed with biopsy, fine needle aspiration, core needle. As in women, invasive ductal carcinoma is the most common histologic type, and most cancer are HR positive. Breast cancer risk factor: HRT, nulliparity, increased age at first live birth, alcohol consumption. HRT, nulliparity, increased risk at first live birth, alcohol consumption, and non-modifiable is genetic mutation of breast cancer in Persian relative, white race, increasing age, and early menarche. Screening mammography is generally initiated at age more than 50 due to increasing risk of breast cancer. Other important risk factors include nulliparity, obesity, prolonged hormone replacement therapy, all of which contribute to increased lifetime estrogen exposure. Nulliparity increases breast cancer risk, similar of a woman with first pregnancy at age 35. Alcohol consumption is a dose-dependent risk factor. Alcohol consumption is a dose-dependent risk factor, and reduced intake will decrease the risk of breast cancer. Reduced intake will decrease the risk of breast cancer. Even low alcohol intake, less than one drink in women, confers an increased risk of breast cancer. So alcohol intake is important. It can cause breast cancer. Testing for genetic mutation BRCA1 and HER2 can first be performed in an affected individual with characteristics of a carrier. Breast cancer diagnosis at age less than 50 at age less than 50. Ovarian cancer at any age. Breast cancer diagnosis at age less than 50 and ovarian cancer at any age. Bilateral mastectomy can be offered to BRCA carriers. Bilateral mastectomy can be offered in BRCA carrier. Bilateral mastectomy done by a famous woman, Angelina Jolie, due to this BRCA mutation. Tumor burden is the single most important prognostic consideration in the treatment of patient with breast cancer. It is based on TNM staging. The following are the important prognostic factor of the breast cancer in order of decreasing significance. ER and PR positive good prognostic factor. Overexpression of the HER2 new oncogenes is related to a worse prognosis. The histological grade also tends to reflect the outcome poorly differentiated tumor and the worse prognosis. Breast cancer warning sign nipple retraction, which causes invasion of the lactiferous duct. Nipple scaling ulceration in epidermal infiltration by the neoplastic cell nipple tissue, intraductal tumor growth and necrosis. Skin retraction, invasion of the suspensory. Skin retraction occurs due to invasion of the suspensory ligament. PUD orange obstruction of the dermal lymphatics, fixed breast mass, invasion into adjacent breast tissue, and axillary lymphadenopathy, lymphatic spread to the regional lymph node. So nipple retraction happens due to invasion of the lactiferous duct, nipple retraction happens due to invasion of the lactiferous duct, nipple tissue, intraductal tumor growth and necrosis, skin retraction, suspensory ligament, invasion of the suspensory ligament, PUD orange obstruction of the dermal lymphatics, and fixed breast mass, invasion into adjacent breast tissue, and axillary lymphadenopathy, lymphatic spread to the regional lymph node, inflammatory breast carcinoma. Now, inflammatory breast carcinoma. It's a very, very rare and aggressive cancer, typically rapid in onset within months and painful. It is very painful, often in men. Symptoms: breast rash, erythema, and warmth. However, mastitis rapidly improves and resolves with antibiotic in most of the patients. Therefore, patients who have limited and no improvement on antibiotic therapy require further evaluation of inflammatory breast carcinoma. Inflammatory breast carcinoma or worsening function. Unlike breast abscess, which typically presents with tender and fluctuant mass, inflammatory breast cancer, cutaneous edema leading to PUD orange appearance. This is the PUD orange appearance, causing superficial skin dimpling. In here, there is superficial skin dimpling and fine pitting. That is not usually seen with infection. This PUD orange not usually seen with infection. This is a picture of PUD orange. Looks like orange shape, and patient with suspected inflammatory breast cancer require breast biopsy like core needle biopsy. This word is very important. Core needle biopsy. Due to high rates of metastasis, inflammatory breast cancer need chemotherapy, mastectomy, and radiation. Infiltrating ductal carcinoma or lobular breast carcinoma may cause skin dimpling and breast may cause skin dimpling or breast contour. In contrast to inflammatory breast carcinoma, these types of breast cancer do not cause diffuse breast erythema, edema, and PUD orange appearance. inflammatory or lobular breast cancer. Uh, Lobular carcinoma, infiltrating ductal carcinoma or lobular breast cancer. Infiltrating ductal carcinoma or lobular carcinoma. In situ lobular carcinoma, lobular breast carcinoma may cause skin dimpling, may change breast contour, but they do not cause diffuse breast erythema, edema, and puree appearance. So, uh, this is very high I'll talk how to differentiate lobular breast carcinoma or infiltrating breast carcinoma from IBC, inflammatory breast carcinoma. IDC versus IBC. Okay, now Paget's disease. Paget's disease of the breast. Memory Paget's disease is suspected when a persistent eczematous. The word is persistent and one is eczematous. Paget's is eczema, eczema, Paget's, eczema, Paget's. Eczematous is an ulcerating rash localized to the nipple and spreads to the areola. Patients experience pain, itching, burning of the affected nipple, no resolution with topical corticosteroid. Approximately 85% patient with Paget's disease of the breast have underlying breast cancer, although a mass is not always palpable. Adenocarcinoma, which refers to the carcinoma that starts in the glandular tissue, that is generally the most common type of breast cancer and is found in Paget's disease. The nipple changes of the Paget's disease are thought to be caused by migration of the neoplastic cell through the mammary ducts to the nipple surface. Further workup should include mammography and biopsy. Now, breast conserving surgery. Breast conserving surgery begins with partial mastectomy, aka lumpectomy, to excise all the invasive and cancer in situ. Mm, and there is along with in situ cancer along with axial sentinel lymph node biopsy. So partial mastectomy to excise all the invasive and in situ cancer along with axial lymph node biopsy. The specimen consisting of the removed tumor and the border surrounding the margin. Partial mastectomy, positive margin, ductal carcinoma in situ at the lateral margin require re-excision of the involved margin. It requires re-excision of the involved margin. In contrast, negative margin indicate local tumor resection from the breast is complete. Sentinel lymph node biopsy typically performed three or more than positive nodes. A positive sentinel lymph nodes may warrant axillary lymph node dissection. In contrast, negative lymph node indicate that lymph node resection. The negative lymph node indicate that the lymph node resection is complete. Following surgery, radiation therapy is performed to eradicate any remaining tumor deposits or none after negative surgical margin are obtained because positive margin double the rate of the local recurrence. Modified radical mastectomy includes mastectomy and axillary lymph node dissection. Modified removal of the entire breast and nipple areolar complex with axillary lymph node dissection. These were selective estrogen receptor modulator IL. Tamoxifen and raloxifene. Tamoxifen is used in breast cancer and raloxifene used in postmenopausal osteoporosis. Can cause hot flash, venous thromboembolism, endometrial hyperplasia, and carcinoma. Only in tamoxifen causing endometrial hyperplasia and carcinoma, but raloxifene does not cause endometrial cancer and hyperplasia, but both of them can cause venous thromboembolism. Tamoxifen is uh, antagonist in the breast. Antagonist in the it is preferred adjuvant treatment for premenopausal women with a low risk of breast cancer recurrence. Tamoxifen is a second line endocrine adjuvant for postmenopausal who cannot use aromatase inhibitor. For postpartum aromatase inhibitor is given. For premenopausal tamoxifen is given. For postmenopausal, mm, the first line is aromatase inhibitor. If a patient is unable to take that drug, then you should go for it. Hot flashes, tamoxifen steroids exhibit anti-estrogenic activity and central nervous system. Tamoxifen acts as an estrogen agonist in the uterus and that can stimulate excessive endometrial proliferation. Tamoxifen use is associated with endometrial polyp and premenopausal women as well as uterine sarcoma and endometrial hyperplasia and cancer in postmenopausal women. All estrogen agonists are tamoxifen, raloxifene, and estrogen containing oral contraceptive increase the risk of venous thromboembolism by increasing the C protein resistance. Pregnancy is contraindicated during breast cancer treatment due to teratogenic effect of such chemotherapy and radiation therapy. Hormone containing methods of contraception are avoided in patients with breast cancer as estrogen boosts and have the proliferative effect of the breast tissue. So when there is breast cancer, you should avoid OCP. If you use OCP, it has estrogen persistent and thus causing increasing these tumor. Copper iode is safe and effective and hormone-free long-term method of contraception. If a patient with breast cancer wants to have sex, they should not use OCP because OCP has hormone and it can induce the enlargement of the breast cancer. So in that case, what you need to do is to find an alternative like copper iode is the alternative in such case. Alloxifene also decreases total and low density lipoprotein cholesterol, although it neither increases nor decreases the risk of coronary heart disease. In contrast, history of coronary artery disease. In contrast, a history of coronary artery disease or estrogen ER positive breast cancer is a contraindication for the treatment of the menopausal symptom with hormone replacement therapy. Trastuzumab, human epidermal growth receptor H, human epidermal growth receptor 2 positive breast cancer is associated with increased risk of cardiotoxicity. So echocardiography should be done as a baseline before jumping into this type of drug. Chemotherapy induced cardiotoxicity can happen. Therapy should be discontinued in patients who develop symptomatic heart failure. Type 1, Type 2. Type 1 associated with anthracycline, myocyte necrosis, destruction, fibrosis, progression to overt clinical heart failure, less likely to be reversible. Associated with trastuzumab, myocardial stunning hibernation without myocyte destruction, asymptomatic left ventricular systolic dysfunction, more likely to be reversible. US Preventive Task Force recommends of the breast cancer screening mammography every 2 years for women 50 to 74 mammogram. Possible beneficial individual 42 mammogram in women, 40 to 49 mammogram in women, uncertain benefit more than 75, uncertain benefit for high risk individual. It has some for 50 to 78, for 50 to 74, from age 50 to 74, mammogram should be done every 2 year for a woman. Mammogram should be done every 2 years for a woman. Breast lymphatic drainage, high level 1 lateral or inferior pectoralis major muscle, level 2 posterior to the pectoralis major, level 3 medial, uh, the medial or superior to pectoralis major, lateral inferior to the pectoralis percival, lateral then posterior, lateral and inferior then posterior, then medial and superior, lateral inferior and superior medial. Superior medial is level 3, superior medial to the pectoralis major is level 3, and posterior is level 2, and one is inferolateral. This is axillary lymph node dissection, surgical lymph node level. Latissimus, this is latissimus dorsi, this is serratus anterior, this is pectoralis major muscle, pectoralis major muscle, latissimus dorsi, and serratus anterior muscle. Sorry, pectoralis minor muscle, pectoralis major muscle. This is long thoracic nerve. This is intercostobrachial nerve, thoraco or dorsal nerve, lateral pectoral nerve, medial pectoral nerve, pectoralis minor nerve arteries. These are the nerve arteries. In here there is level 1 node, level 2 node, level 3 node. Level 1 inferior lateral, level 2 posterior, and level 3 superior and medial. Superior medial, level 3 superior medial, inferior lateral, and it has not been seen, so it is posterior. Finally, the contraceptives, copper containing iod has benefit, no effects for copper containing iod, no effect on hypertension, and high efficacy and high 99% pregnancy prevention, no effect on future fertility, no effect on future fertility, no effect on future fertility. Long acting reversible contraceptives, non acting reversible copper containing iodine are highly effective for pregnancy prevention and can be used in patients with contraindication of estrogen, including OCP. Contraindication of the IUD placement, copper, IUD and progestin implant, pregnancy, endometrial or cervical cancer, unexplained vaginal bleeding, gestational trophoblastic disease, distorted endometrial cavity, acute PID and cervicitis. Progestin IOD should be contraindicated in active liver, active breast cancer, and copper IOD should not be given in Wilson disease because Wilson has copper metabolism problem, so it cannot be given. This is IODs. This is IOD. May be used in all ages and parity, unexplained abnormal bleeding, and is a contraindication of IUD insertion because it may indicate an underlying endometrial cancer. Patient with unexplained vaginal bleeding require evaluation to rule out endometrial cancer. It's a safe long-term hormone-free methods of contraception. Safe long-term hormone-free. 99%. It is 99% effective. It is 99% effective and prevents pregnancy. This is copper IUD. This is shrinks, causes endometrial inflammation, toxic to the sperm and the ovum, levonorgestrel iod. This is copper iod, not should not be given in Wilson disease. This is levonorgestrel iod. Levonorgestrel releasing iod may cause amenorrhea by thinning the endometrium. In contrast, copper using iodine can cause hypermenstrual bleeding and dysmenorrhea. That's all about the 10 page. Hope you enjoyed this series.